Hello, this is Debu Tripathy, Editor-in-Chief of Cure Magazine, and I am here in San Antonio where quite a few new studies have been presented that are really affecting how we approach and treat patients. One of the updates is that on localized or partial breast radiation, also known as brachytherapy. This is a type of radiation therapy that's delivered in a much shorter period of time to just a part of the breast instead of the whole breast. Whenever patients have breast-conserving surgery for breast cancer, radiation is commonly used because it really lowers the risk of the cancer coming back within the breast and allows us to use breast-conserving surgery. However, it is somewhat cumbersome. It takes about 6 weeks to deliver. It's daily treatment over that period of time, and it may radiate parts of the breast that don't need radiation. So localized radiotherapy, so-called partial breast irradiation, has been now looked at for several years, and some of the results show that you might have just as good lowering of the risk of local recurrence with partial breast irradiation. There are several different forms of partial breast irradiation. Some of them can be done by simply sculpting the beam using sophisticated computers, so-called intensity modulated radiation therapy. Another way to do it is to use a different type of radiation that only travels a few millimeters, but is placed right in proximity of where the surgeon removed the tumor. And this is called brachytherapy, and it can be done by either putting a small balloon that contains a radioactive source or using radioactive wires. There was an update on the results of brachytherapy from a large series of patients who had undergone this procedure, and it was compared to patients who had had standard external beam radiation that's given over 6 weeks. And over the time of follow-up, it was shown that the local recurrence rates are higher with brachytherapy. And so whether or not this is going to have an immediate impact is unclear. This is somewhat of a controversial finding because there is a large randomized study that's still ongoing that's looking not only at brachytherapy but other forms of partial breast irradiation that is going to report its results. And over the last 2 years, there have been results coming out of intraoperative radiation therapy, which is also given just at one dose at the time of surgery. And that study was a large randomized study and actually showed a very low local recurrence rate in the randomized study that compared intraoperative radiotherapy to standard external beam. So we have conflicting results here on the results of partial breast irradiation. I think it's going to be a complicated story because certain types, like brachytherapy, might not be as effective as other forms of accelerated partial breast radiation. So I think this is still work in progress. The important thing for those of you that are considering this decision is to talk to your surgeon and your radiation therapist about the different criteria for who are the best candidates to get this type of therapy, and make sure that your case fits into this and that you are aware of the latest information and what the risks and benefits are. It may be that a slightly higher risk of local recurrence might be acceptable as a trade-off for the convenience, especially if that small increase in the risk of local recurrence is not going to have any impact on your mortality from breast cancer, which is probably the case. So again, this is a complicated area, but does require personalized decision-making, and at least we now have some numbers that patients can look in evaluating the pros and cons of this treatment. So I thank you for joining us for this update.